Welcome, and I'm so glad that so many of you are joining us today to discuss how the new American Rescue Plan can work to strengthen the prenatal-to-3 system of care. This is really a historic and unprecedented amount of resources that our children and families are going to have access to. And so we wanted to have a discussion today about how this will be benefiting states, what states will be doing, and what this policy can really mean for the well-being of our families. Make sure I'm joined today by my colleague, Greg Duncan, who is a distinguished professor at the University of California at Irvine, and actually laid the blueprint for much of this American Rescue Plan, particularly with regard to the child allowance. And we're going to be excited to learn more from him about that. I was also going to be joined today by Denise Forte from the Education Trust, but she has actually the best excuse that anyone could have in these times for being absent today. She is actually ill because she got her second dose of her vaccine. I don't wish anyone ever to be sick, but that is a good reason, and I wish her that she gets feeling better soon, and then to be fully vaccinated is something that I know I look forward to. My name is Cynthia Osborne, and I'm at the University of Texas at Austin, and I have the privilege of directing the Prenatal-to-3 Policy Impact Center. And our whole goal at the Policy Impact Center is to inform states about the most effective policies that really try to build this system of care for infants and toddlers and their parents. And the American Rescue Plan is going to be a real boon for states to be able to introduce evidence-based policies, to be innovative and creative, and find ways to really strengthen our families and the institutions that serve them. So the American Rescue Plan does a whole lot, much more than what it does just for infants and toddlers and their parents. But we're going to focus primarily on that group today and the provisions within the new act that are focused on families. So I'm going to be excluding some of the great work that is going to happen at the K-12 level, some in their communities to shore up businesses and unemployment insurance and other sorts of things. And I'm going to focus on many of the aspects of the new American Rescue Plan that expand eligibility for programs, that increase the value and refundability of some of our tax credits, that provide substantial increases in funding for many of our institutions, particularly childcare, and to discuss how this new act has the probability of creating equity and reducing child poverty. One of the things that I like best about the American Rescue Plan is that it truly is based and driven by evidence-based solutions. And I will demonstrate to you how it's aligned with so many of the effective policies that we've identified. But it's also going to give us a chance to experiment and explore what works and let us build the evidence base so that we can understand which of the policies are effective, for whom, and under what conditions. So we're going to talk about the child tax credits. We're going to talk about the childcare industry. We're going to talk about health insurance and so forth. But the idea here is that the American Rescue Plan helps to create a system of care. I'm sure that each of you who is watching has your own favorite part of the rescue plan, the thing that you are responsible for or have been advocating for years, and that you're happy to see it. I do hope, though, that you think about this as a system of care with the family in the middle, and how we as those who are here to try to support families can do a better job. And so I'll be introducing to you kind of the full range of the provisions within the Act that will support our infants and toddlers and their parents, and to go into detail about some of them. I hope that all of you have had an opportunity to see a new research brief that we put out. I encourage you to look at it if you can at our website at pn3policy.org/resources. And it goes through in pretty great detail many of the aspects of the things that I'll be discussing today. There's also so many great resources that are being introduced to the field right now from some of our partners out there, from CLASP and 0 to 3 and Center for Children and Families and the Kaiser Family Foundation and numerous others. And I think there's so many resources for states to be able to turn to, including one another, to learn how we can best make efficient use of these dollars that are really historic in their level. And like I said, there are a lot of things in the American Rescue Plan that are important for communities and states and families. And I'm going to focus on those that are primarily aimed at helping infants and toddlers and their parents. And although I care about kids across the lifespan, my children are now 19 and almost 21, so all ages to me are extremely important. The research, however, is clear that the prenatal to age 3 period is the most rapid and sensitive period of development. And it really sets the stage for all subsequent well-being. But if we can get it right in those earliest years, we can set children on a trajectory for health and well-being across their life course. At birth, our brains are expecting to be wired. They're expecting input to tell us how we are supposed to exist in our environment, what is safe, what is scary, what's normal, what is outside of that. And that if we can provide a nurturing, stable, loving, caring environment for our littlest ones, that's really all they need in order to get off to a healthy start. That when children are exposed to adversity early on, due to lack of resources or social exclusion, hunger, homelessness, trauma, when they're exposed to those sorts of adversity, that it really harms their both biological and neurological development, and it has lifelong consequences. So the American Rescue Plan helps us to create these conditions in which children are going to thrive. And importantly, the American Rescue Plan also understands or demonstrates that how important it is that we have to care for the caregivers who are going to care for the children, whether it's their parents or their child care providers, home visitors, or others, that they need the support in order to make sure that their health and well-being is optimal so that they can care for our children. It also just speaks to the importance that it takes a system. There is no magic bullet. There's no one policy that's going to do it all. And we need a combination of broad-based economic and family supports and targeted interventions. And this new act actually provides funding and resources for this broad-based system of care. At the Policy Impact Center, we identified 8 policy goals that really set the conditions that children need in order to thrive. And these are driven by the science of the developing child. And they range from making sure that we have access to the services that we're eligible for, that parents are able to work and balance working and caring for their children, that they have access to sufficient and stable resources, that our children are born healthy to healthy parents, that parents have the physical and emotional well-being that they need to be the parents that they strive to be and that their children deserve, that parents are engaging in nurturing relationships between themselves and their children. And when children are not with their parents, that they're in nurturing relationships with their child care providers in safe and stable arrangements. And finally, to make sure that when children have needs, that those needs are identified early and addressed so that we can make sure that we can get them back on track for optimal development. So that's what we're striving for. And what we did at the Impact Center was to say, well, what are the most effective policies that states can implement that will actually achieve those policy goals, that will create those conditions in which children will thrive. And I'm going to briefly go through what those policies and strategies are. And what we are doing is we're tracking states' progress toward adopting and implementing these policies and strategies, as well as tracking changes in outcomes and children's well-being as a result. And again, the American Rescue Plan provides an option for states to really expand on up to 10 of the 11 policies and strategies that we identified. The 5 policies that we identified in our state policy roadmap have to do with making sure that families have access to health insurance, that they experience limited administrative burden when it comes to accessing resources, and we pay particular attention to SNAP, that families have the opportunity to have time off from work after having a child, either through birth or adoption or fostering, that work actually pays, and that the state right now has a minimum wage of at least $10 an hour, if not more. And that we also know that a state earned income tax credit can help to provide additional resources to families, and that if it's refundable and at least 10% of the federal EITC, that it can actually create true advantages for families. We also identified 6 effective strategies, and the only difference between a policy and a strategy is that a strategy is effective. It's the evidence or the research just doesn't provide us with clear guidance on exactly what states are supposed to do. So we're still trying to learn the optimal amount of funding that you would need in order to fund group prenatal care or evidence-based home visiting programs and so forth. But making sure that families are screened and connected to the services that they need, that they can access high quality childcare in an affordable way, group prenatal care that provides that social support for parents to improve prenatal outcomes, evidence-based home visiting programs that will help to enhance parenting skills, early Head Start that provides a nurturing environment that engages with the family and helps to educate our kids both in mind and body and spirit, as well as early intervention services that identify children's developmental delays early and get them back on track. And also in our roadmap, we identified how each of these policies and strategies align or work to improve those 8 policy goals. So I encourage you to look through our state policy roadmap so that you understand which policies will help you to best meet those goals. This is the alignment between the policies, and there's also an alignment between the strategies and those goals. And I'm going to just briefly summarize how the American Rescue Plan actually is going to help states to implement some of these policies. Again, up to 10 of the 11 have the potential to be impacted by the American Rescue Plan. And I'll go into greater detail about these, but in terms of expanding income eligibility for health insurance with Medicaid expansion, the American Rescue Plan will both provide incentives for states who haven't expanded their Medicaid to do so. It will allow for Medicaid coverage to extend postpartum from 60 days to up to a year. And it's also going to reduce the monthly payments that families have to make on health insurance. With SNAP, it's providing a significant amount of money to help with SNAP administration, which can help to reduce administrative burden by reducing recertification intervals, helping to make it so that all things can be online. And it's also extending the 15% increase in SNAP benefits. There are still opportunities for families to take advantage of tax credits based on family leave or sick leave. That's going to extend through September of this year instead of through this next month. The final plan had no increase in the minimum wage, so that's the one policy that isn't impacted. And our state earned income tax credit, the American Rescue Plan does not affect the state earned income tax credit for parents. However, it does expand it for workers without children. And this is really important for our non-custodial parents, for young adults who are not yet parents but are considering forming a relationship or thinking about having a child. So this is going to have an impact on them. And the American Rescue Plan increases funding for home visiting programs, and Family Connects, which is a comprehensive screening and connecting program, is on the list of programs that can be expanded. The American Rescue Plan provides substantial increases in funding, both for new funding in their Child Care and Development Block Grant, as well as a stabilization fund to really help to create more affordable, high-quality childcare for our families. And although our group prenatal care isn't directly addressed in the rescue plan, it can be paid for from Medicaid, which therefore is indirectly supported. The new act provides $150 million in additional funding for evidence-based home visiting programs, another $1 billion in early Head Start, and $250 million to states for more early intervention services. So really, nearly every one of these 11 effective solutions are being supported by the American Rescue Plan. And these are not the only things that it does, but these are the 11 that we identified have the strongest evidence base. And fortunately, states are going to be able to experiment with new things, and we're going to be able to learn even more about what works for children. I just wanted to give a range of the fact that states are already considering many of these policies in terms of what they're considering adopting or changing or expanding. And with the American Rescue Plan funding in place, there might be an opportunity for even more states to do even more. And like I said, some of the provisions that are not directly aligned with our state policies, but we have 25 states who are already been considering extending pregnancy for Medicaid coverage 12 months postpartum. And the new plan is going to allow them to do that now with a state plan amendment instead of an 1115 waiver, or using state funds to do that. New Jersey has already introduced legislation to offer a universal newborn home nurse visitation program akin to Family Connects. And there's several states that have been looking to increase their child care subsidies. So a lot of the things that we laid out in the roadmap, states have been busy implementing, and the rescue plan is just going to allow them to do even more. I'm going to speak just briefly about each of the aspects of the plan and how it's aligned with some of our goals. And mostly I'm going to focus on the health insurance and childcare, and then some of the tax credits. But where the expansion of the health insurance really matters here is in the two provisions with regard to extending healthcare coverage to women postpartum for up to 12 months rather than 60 days, and to incentivize the states that have not expanded Medicaid to do so by providing them with an additional 5 percentage point match in their FMAP, or what it is that the states are obligated to match to the federal contribution. I wanted to just use this graphic to explain why this is going to matter so much for all states, but especially in our non-expansion states. And this is a graph, and I encourage you to read the full report that was written by folks at the Kaiser Family Foundation, as well as folks from the Center for Children and Families at Georgetown. The work that they're doing in the area of Medicaid expansion is just truly extraordinary and a resource for all of you to look for. But what this does is it shows you the difference in the income eligibility thresholds in our non-expansion states. And the blue line is what the income eligibility threshold is for people who are pregnant, and the orange is for parents. And none of the non-expansion states are childless adults eligible for Medicaid. So There's no fathers who are eligible. There's no childless adults who are eligible for Medicaid if you have not expanded Medicaid through the ACA. If you have expanded Medicaid through the ACA, that orange line, dotted line going across at 138% of the federal poverty level, that's the level in which folks who earn incomes at that level or below are eligible for Medicaid. Those above that line in the expansion states are able to buy insurance in the marketplace. And the American Rescue Plan now will basically reduce the amount of insurance premiums that folks in the marketplace have to pay, and it will allow those to remain being covered in the expansion states. So if you take Texas, where I'm from, you have to have an income no greater than 17% of the federal poverty level. That's about $300 a month. And if your income is greater than that, you are not eligible for Medicaid as a parent. Again, childless workers or childless individuals are not eligible anyway. And you're not able to buy insurance on the marketplace either. And if you become pregnant, then you are eligible for Medicaid because they're covering it basically to care for the unborn child at that moment. So up to 207% of the federal poverty level is the income threshold for pregnant moms. Well, once that mom has her baby, she is only covered for 60 days currently. And then she loses Medicaid coverage completely unless she makes less than 17% of the federal poverty level. And so you can really see how new moms can fall out of health insurance, especially in the non-expansion states. But even in states that have expanded health insurance, that difference between the blue bar and that orange dotted line, those are moms who will have to move from their pregnancy Medicaid coverage down to kind of the regular Medicaid coverage. And that churn and reapplication and making sure that you're covered again, we lose a lot of moms in that transition period. So that's why extending it to 12 months postpartum will allow those moms to stay on health insurance. We know that maternal mortality takes place during the first year of a child's life, not just in those first 60 days. And it's really important that moms have access to the mental health care that they need and the physical health care that they need. So I can answer more questions about how important this is, but the changes to incentivize those non-expansion states to come up to that orange threshold is really an important one. We also know that families now will have access to our needed nutrition services. There will be quite a few changes in order to make it so families have access to the free and reduced price lunch program and so forth. But the ones that are most specific to the infants and toddlers is that families will now be able to continue that 15% increase in their SNAP benefits until the end of September, and that there was some increases in the WIC payments for each month. But what's really important for states is that there's this $1.1 billion in state grants that will allow states to really improve the way that they administer SNAP. There is huge variation across states in the proportion of folks who are eligible for SNAP versus those who actually receive it. And so what we're going to be tracking are those states who change their administrative processes to make sure that all of families who are eligible actually receive those benefits. The child care work, the changes in the child care funding are just really unprecedented. And it's the work of so many of you for years who have been pushing for this. And the pandemic has really exposed the need. And this additional influx of resources, a $15 billion investment in the Child Care Development Block Grant, $24 billion in stabilization funds, $1 billion in Early Head Start and Head Start. These are real dollars that states can use. And there's a range of things that states will be doing, but many are going to spend them to stop the bleeding, to make sure that those providers who have really struggled to keep their doors open or have had to close during the pandemic can be put back to business. Until our child care providers are in business, our businesses can't really open. We're going to use them to help states pay the family portion of what is owed each month, or what's sometimes referred to as the co-payment. They're going to extend childcare to essential workers. They're going to invest in higher compensation for the workforce to make sure that our childcare providers are treated like the professionals that they are. They're going to improve the credentialing and the training of our childcare providers. Maybe several states are considering introducing mental health consultation. There's a range of programs or ideas that states can implement to really shore up their childcare systems and to make it so that parents can access high quality care. This is just an excerpt from a graph that we have in the roadmap that just demonstrates the variation across states and what families are expected to pay and the overall cost of care. So the blue lines have to do with what the kind of total cost of care, or the length of the whole line rather, is the total cost of care within that state, kind of based on market rate surveys, which we know underestimate the true cost of care. So this is the total price of care. And you can see that there's kind of the first color blue is the state's contribution, and the dark blue is the co-payment. And some states even allow childcare providers to charge families an additional fee. And what the American Rescue Plan will allow states to do is basically eliminate those co-payments. That you can see in a state like Texas, both the co-payment and the fee amount to nearly half the cost of care. And this would allow the state to reduce that co-payment so that it's a reasonable portion of a family's overall income and cost of care. It will also allow states to extend that line to actually pay more so that we're covering the real cost of care and not just the price that's being charged. That if we are going to pay our workforce what they're worth, if we're going to have the quality elements within our childcare that we need to take those things into consideration. So ARPA is going to allow us to extend those lines and make the state contribution more substantial. There is lots in the American Rescue Plan to help promote optimal health and development for children. In particular, the early intervention, or Part C of the IDEA Act, will receive another $250 million. There's support for our child traumatic stress network. There is increase in CDCAP funds and in our pediatric mental health access programs. So lots of different funding streams that will come in to support these existing programs. Greg Duncan is going to spend time talking more about the expanded tax credits. But this is an area that has really made the news because we're going to provide, at least for 1 year, basically a child allowance to nearly 90% of our families out there. 96% of children in Mississippi are going to be eligible for this child tax credit that will now be fully refundable. And there's some talk about how it will actually be implemented, but right now the plan is that there will be a monthly disbursement of this tax credit from July through December, and then a one-time payment at the next tax season. We'll learn more about how it's actually going to be implemented. But this has the opportunity to put up to $3,600 per child in a family's wallets. And that makes a huge difference. Right now, they have only been eligible for a small portion of that, and it has not been fully refundable. And so now this is going to have an opportunity to really reach so many more families. Many of our peer countries, including Canada and the United Kingdom, have a child allowance. And the one in Canada that has been more recently implemented substantially reduced child poverty. And the estimates of reducing child poverty here in the United States are actually just huge. There is also going to be a substantial expansion of the child and dependent care tax credit, so that now that is refundable and enlarged. This is just a graph here from our partners at the Tax Policy Center on the left, and then folks at the Center for Poverty and Social Policy at Columbia, Chris Weimer and his group on the right, that will really show the difference in what they're currently getting out of the child tax credit, and then what the expansion will allow. And in the lighter blue gray color, that is what the expansion is going to bring. And you can see that it will have the biggest impact on our lowest income families, those who have generally been left out of being able to receive the child tax credit as it stands, because it hasn't all been refundable. And even more exciting about the child tax credit is that the estimates of what these tax credits are going to do in terms of reducing poverty are just so substantial. And they are going to do it for each race and ethnic group. And these rates have been, or the estimates have been changing over time as we learn more about how it will be implemented and everything. So, the updates will be coming as more information comes out. But you can see that it's estimated to reduce child Black poverty from 21.5% of children who are living in poverty now to fewer than 10%. And for each race and ethnic group, this reduction will be substantial. I do want to note, however, that even after these substantial investments, still close to 1 out of 10 children who are Black or Hispanic will still be living in poverty. And that's something that we need to continue to work at. And it's more structural rather than just a tax credit. It's about wealth, it's about income, it's about opportunity. I'm going to round out here to just say that there are lots of other investments here that we have talked about. The additional funding for home visiting, the housing programs, the unemployment assistance, the economic stimulus package, the paid leave, that again, working together, all can help to create these supports for families. And where states begin, I've talked with several folks from several states, and many are excited for the challenge ahead, but a little daunted by it. The funding levels are substantial, but many are time limited, and we have to make decisions quickly, get the money obligated, and to demonstrate that we can actually do this effectively and that it will create better outcomes. There are a lot of folks who are going to focus on the things that are on fire first, making sure that we invest in our caregivers, that we reduce the cost to our families, that we make sure we bring back our child care providers, that we are able to make it so that families can afford to cover their health insurance, cover their child care. I also hear states talking about using this as an opportunity to think about how they administer their services and trying to reduce the administrative burden and think about this as a system of care, and how families, do they have to fill out a different form for every single service, or are there ways that we can share that sort of information and reduce the amount of administrative burden, so that more families who are eligible actually receive the services. We have to focus on our underserved communities, and we have to think about our strategies to promote greater equity. Part of that can be done through administrative burden. Part of that can be done through really investing in our childcare workforce. But it is something that states have to make a priority. We also have to demonstrate that we can do it. I have faith in states. I'm excited to see what everyone does do and to learn from you and others. But this is a daunting task, and paying attention to making sure that our funds are spent well is going to increase the likelihood that these changes will be made permanent. And the researcher in me hopes that we also use this as an opportunity to learn, to see, as you at the state level are implementing new ideas, let's put evaluations in place and to learn what works for whom, under what conditions, and does that actually close the gaps in the disparities that currently exist. So I'm going to stop sharing my screen here and introduce my colleague, Greg Duncan. And I've had the pleasure of working with Greg as a member of a National Academies committee that he chaired. The committee designed to reduce child poverty in half within 10 years. And I don't think that when we started that committee work that anyone would think that within a matter of a couple of years after the report came out that you're going to get to see this kind of manifest in real life. I think that was some what people may have wished for but never thought could be a reality. Unfortunately, we also didn't think a pandemic would be a reality and that our families would be in the situation, our economy would be in the situation that it is. So, this is kind of a blessing and with a curse. But Greg has been instrumental in that, as well as one of the key researchers on a child allowance called Baby's First Years that's going on in 4 different communities, and just really one of the kind of major researchers in the field of child development, and has told us nearly everything we know about how poverty affects children. So I'm going to turn it over to Greg now, and he's going to talk for a little bit about, in more detail about the child allowance piece, and then we'll come back and have more of a conversation as well. So Greg, welcome, and thank you so much for being here.
Thank you. It's a pleasure to be here. Hello, everybody. I'm very delighted to participate with Cynthia in this webinar. When we first talked about how the committee was going to go about doing its business, this was the last month of the Obama administration. And I remember sitting around the table and being advised that, well, we should probably get the report out in 18 months or less in order to have any effect on Hillary Clinton's agenda. So history turns and twists in ironic ways. It took us 2+ years to get the report out. But as it turned out, the timing was very, very good. It worked out to be a resource that would be available for this American Rescue Plan. And who would have thought back 4 years ago when we were first planning this? I want to talk briefly about the report and its some of its recommendations. It's the mandate for the report was to come up with ideas for reducing child poverty dramatically by 50% in a period of 10 years. So this 10-year time limit imposed a lot of constraints on the kind of programs that we would be able to consider. I think a lot of the programs that Cynthia talked about are really intergenerational programs that we invest in home visiting and other kinds of early care and support in order for children to grow up and have a smaller likelihood of being in poverty themselves when they become adults. That kind of intergenerational perspective is going to be the subject of another committee that is just being formed at the National Academy of Sciences. But our own committee focused on the short run, on steps that would reduce child poverty dramatically in 10 years. So we developed a wide range, 20 different policy and program ideas. And then simulated with some big micro simulation model the extent to which each program would reduce child poverty and the extent to which each program would change labor supply, the amount of work among low-income adults, both in a positive direction or a negative direction, depending on what the research suggested. So I want to talk about just a couple of provisions in the American Rescue Plan that overlap with the kind of programs that our committee. They didn't recommend programs. We had a very diverse committee, politically diverse, disciplinarily diverse. We had state people and national people, a lot of researchers. And the idea that such a diverse group could recommend anything was a little bit far-fetched, given the range of political ideologies around the table. But what we did do is recommend policy and program ideas that we thought policymakers should consider. And two of these made it into the American Rescue Plan, as Cynthia noted. One was the expansion of the child tax credit, making it effectively a child allowance. And the other, which is kind of under the radar, but has some potentially important implications, is an expansion of the child and dependent care tax credit. So let me go over each of those in turn. The child allowance, this $3,000 for kids older than 6 and $3,600 for kids under 6, is a huge turning point, really, in the construction of the American safety net. It's revolutionary in two senses. One, it's unconditional support. Families who get these payments are not constrained at all. They don't have to use it to buy food. They don't have to use it to buy housing. They don't have to use it to buy medical services. So they are empowered to make decisions about how the money is to be spent. And the other, we had the old AFDC program had that characteristic. TANF has that characteristic, TANF payments, but TANF has become non-existent in a lot of states and very small amounts of money. And much of our safety net is still through conditioned payments, food stamps and housing vouchers and things like that. So it's revolutionary in that sense, that it's unconditional, but it's also revolutionary, and I think this is the most important thing to remember, in that it's a virtually universal program, right? So it does phase out when family income is in the hundreds of thousands of dollars, but it applies all the way down to $0 of income. We had a child allowance in the form of a child tax credit, which is $2,000 per child per year, but that full amount was only available to families that had substantial amounts of taxable income. This is unconditional all the way down to zero income, but all the way up to several $100,000 of income. So no longer is our cash assistance program limited just to very low income families. If you think about the history of the American Aid to Families with Dependent Children program, AFDC, the TANF program, these programs always get stigmatized. And there's a lot of pressure to reduce them, to give a lot of power to the states to decide what to do with the money. But the fact that this is universal recognizes the fact that all families, regardless of income, have extra needs for income when they have children, right? If you look at the original child tax credit back in 1997 is when it started. The legislative language said this was in recognition of the need for additional money when families had children. So this is just saying, yes, that is certainly true, and it's true not only, or maybe especially, for families with very low incomes relative to middle class families and upper middle class families. So it's, the provision is only there for 1 year. There is certainly a lot of talk and support among Democrats, at least, for extending it in various ways through legislation that's now being considered. I think many hope that it simply becomes a kind of child allowance policy that all other industrialized nations have. We'll see. But the idea that it's a payment per child, the idea that it's a payment regardless of income level, the idea that eventually it will become a monthly payment, that was the intention, and that was a strong recommendation of our committee. All those elements are very important, and we will have. We'll see how it plays out this year. The hope was to have monthly payments for at least 6 months, as Cynthia talked about. Whether the IRS can handle that administratively or not, it might be a quarterly payment. But the hope is eventually that this is going to be something that is a regular monthly program that's either administered by the IRS or maybe administered by the Social Security Administration. We'll have to see. Very briefly, the other component is this child independent care tax credit expansion, which we've always had this child care tax credit. It's been available for upper income families, middle income families. It hasn't really been important at all for low income families. And one of the provisions in the American Rescue Plan is to provide this child care assistance without any sort of lower income limit. So it would be totally refundable down to $0 of income, and we would reimburse for 50% of the expenses, childcare expenses that would be incurred. The devil is in the details here, and actually coming up with a system of reimbursement that works for families. Given the fact that they can't wait until they file income taxes a year later to get reimbursed for childcare expenses that they need tomorrow in order to be able to work. That's a difficult problem, as everybody knows. And it leads a lot of people to be in favor of the kind of a block grant subsidy kind of approach. But I think the committee felt that if this reimbursement problem can be solved, if families can be reimbursed in a timely manner, that this has a potential for rather important reductions in poverty, and it also is going to facilitate entry into the labor market. So one of the things that we did was to not only look at reductions in poverty, which are huge in the case, as Cynthia says, for the child tax credit, the child allowance, but also substantial for the child independent care tax credit expansion, and the kind of labor supply implications for a child tax credit are a modest decline in the amount of work, about a 0.5% decline in the size of the low-income workforce. On the other hand, this child independent care tax credit expansion would result in a dramatic increase in the amount of low-income work. So the final kind of lesson that I'll talk about before we turn to questions that came out of the committee was the importance of thinking about packages of programs that in combination would accomplish a number of goals, including dramatic reductions in child poverty, we've already talked about, but at the same time resulting in an increase in the number of adults that are working. One of the kind of classic objections to safety net kind of programs is that it has work disincentives. And what we showed in the committee is that by combining programs, some of which are income support programs, some of which are work-oriented programs, you can really have the best of both worlds, dramatic reductions in poverty, but at the same time, net increases in the amount of low-income work. So let me stop there, Cynthia, and see if you have anything to talk about.
Yeah, well, Greg, thank you for that. I had a couple of questions. There's lots of questions coming in from our folks who are participating. I encourage you to continue to submit questions. We'll do our best to get them answered. This was part of a question that came in, but also from mine. So you're an economist. Tell us about what having this only be 1 year might do to the family's incentives for how they use the money and so forth. If we knew that this was going to be permanent, the child allowance was going to be permanent, would families think about spending that money differently? May it have a different effect on our families than the fact that it's just going to be 1 year? And should that be something that we're anticipating, kind of keeping in mind in terms of those spending effects or work effects?
It's a great question. There isn't really a very definitive answer to that. Given the nature of instability, this is something that our committee talked a lot about in the lives of low-income families. There's so many immediate needs: paying rent, paying childcare. Being able to weather the kind of emergencies that pop up on a regular basis requires a financial reserve that most families don't have. So I suspect that that there will be mostly just a channeling of this income toward those immediate needs. We'll talk in a second about a research project that I'm involved with that is showing some families are very likely to be viewing this as an opportunity to generate some savings. But I think most families are just too much in need of covering the short-term needs to think about building up a big savings reserve with it.
Right. You also talked about that we're not exactly sure how it's going to be administered. There are consequences if it is administered through the IRS or the Social Security Administration. Things that are administered through the IRS, like the Earned Income Tax Credit, don't count against individuals' eligibility for other resources. It doesn't count towards their income. Whereas things administered through the Social Security Administration, like Social Security, it does count toward income. Can you give us insight as to the pros and cons of either of those, and maybe what you've learned about the potential impact that it might have on benefits cliffs, or the idea that it might raise your income to a level that would make you no longer eligible for things like food stamps, for instance, or something? Do you have any insights or thoughts about that?
Yeah, I mean, how it gets paid is pretty independent from whether or not it gets counted as countable income for the determination of benefits, right? So those two decisions can be taken independently, right? And you raise this issue of benefit cliffs, and it's certainly a classic problem in social policy. There are various ways of reducing the chance that that's the case. Usually, if you don't count it as countable income, then you don't get the benefit cliffs. But on the other hand, it's more expensive. So at some point, if this does become permanent, it's going to have to be integrated into the system of other benefits. I know that the Romney alternative plan for a child allowance coupled the child allowance with substantial cuts in other programs, right? And that's one way to do the integration. Another way to do it is on top, expending more money. So that's all a policy decision that's going to have to be played out. With respect to administering, the Social Security Administration is great at sending out monthly checks. They do it all the time. And they do it, at fairly low cost and at relatively high rates of efficiency and accuracy. So you'd think that, again, over the long run, that the Social Security Administration getting information from the IRS about which children belong in which families might be the best system. The IRS just isn't set up for kind of monthly payment of benefits in the same way Social Security is. So I suspect that again, that's going to be playing out over the longer run if legislation is successful to continue the payments themselves.
Right. Good. When the Earned Income Tax Credit was first rolled out, it was expanded a lot in 1996, but obviously it's been around for quite a while. But even during that expansion, it took a while for families to understand what it was and that they were eligible for it. States had to go to great lengths, organizations, advocacy groups to inform us about it. And there were some for-profit folks who came in and figured it out pretty quickly of how to service families. What can states be thinking about? What lessons can we learn from that might help states think about how to get people access to these benefits? Is there anything that states should be thinking about, or advocacy groups, that can improve the use and the take-up of these universal benefits? But we have to find you.
Yeah, well, I think many of your listeners will probably have more to say about this, but there's a huge need, right? If you think about how complicated this plan is, so many different changes to so many different benefits, that the information needs are going to be immense. And as you say, the success that states and various nonprofits had in rolling out information campaigns and had a real impact on take-up in these programs, right? Indicates that there's likely to be both that kind of need again, as well as a capacity on the part of both government and nonprofits to organize to deliver that. It's not an easy thing to do. It's a lot of door knocking and going to communities. But the money is there for people to take advantage of, and it's so important for people to understand that and to be able to get the benefits that they are entitled to. Yeah.
You mentioned that I told you I wanted to ask you more about this real landmark study that you and several others, Kim Noble, Catherine Magnuson, I know, are two of the PIs that called Baby's First Years. And it has been shining a light on what a child allowance might look like here in the United States, or at least maybe not universal to all, but in some ways. And you guys have hit, from a research perspective, a stumble in that your control group just got $3,600 a month for all of their children. Tell us about this study that you've been doing, and what you think that I know that the results are still not in, but what you've been learning from that, and what states may learn from this as we watch this, as they try to roll out the other child allowance, the new one.
Yeah, this is my favorite topic. It's something we've been working on for 8 years. The actual study began in 2019, and the idea was to test whether a child allowance begun at birth of $4,000 a year would change families and kids, in ways that were beneficial. It keys off the kind of neuroscience research that you mentioned, highlighting the importance of the first few years. So the idea was to recruit 1,000 mothers in 4 communities around the country: New Orleans, Omaha, the Twin Cities, New York City, and with their consent, randomize them into 2 groups. One group getting $333 a month on a debit card that we handed them in the hospital shortly after giving birth. The other group getting $20 a month, right? So it's either $4,000 a year or $240 a year. Everybody gets something for 40 months beyond the child's 3rd birthday. We're now extending that by a year. And the idea is to visit them, we hoped in person, but that kind of went by the wayside a year ago. And around the time the children were celebrating their first birthdays, their second birthdays, their third birthdays, and now we're going to do a fourth birthday follow-up, and find out not only how the kids are doing, which becomes more and more reliable at age 2 and especially 3 and then 4, but early on, the idea is to try to find out to what extent families are being affected. In terms of mental health, in terms of how they're using the money, in terms of work, in terms of using the money for books and toys and food expenditures and rent, all the ways in which that kind of money and the kind of money that the American Rescue Plan is going to be paying out might affect families. And as you say, COVID hit, but the American Rescue Plan is hitting also. So whenever you have a study like this, you can generalize to the circumstances that prevailed at the time the study was running, right? So for most of the first year, the unemployment rate in February 2020 was 3.2%. It's never, in the last 60 years, it's never been as low. So it was boom times, followed by the pandemic, right? Followed by the American Rescue Plan, which the benefits will start coming later. It's unclear, how frequently and so forth. But the advantage of a study like ours is that we still have this contrast between the treatment group and the control group. So everything that's happening to the low cash group is happening to the high cash group. But interpreting, generalizing from the results has to be done in the context of this is all playing out in boom times and then in a pandemic and then with the American Rescue Plan. So it's true that for at least this 1 year, both sets of families are going to be getting $3,600. So whatever their incomes were for both groups, it's going to be increased by $3,600. And then we're still doing another $4,000 on top of that, right? So we'll see. We would have wished for calmer times, but it is what it is. And we're almost ready to start releasing our results from age 1. But one of the things that we're doing, Sarah Halpern-Meekin is running a qualitative study. We selected 80 families at random from 2 of our sites, the Twin Cities and New Orleans, families from both the high and low cash groups, and conducting these very long, open-ended kind of interviews, finding out how they, what their backgrounds are, what family life is, and how they're thinking about this kind of money. And many of them, even the low cash group, thought it was something of a miracle when our interviewers showed up in the hospital. The card says "for my baby," and it gets loaded up every single month. We send a text message, and we're going to be able to track how they're using that money. But it's clearly highly valued. It's also, as I mentioned before, viewed by some as a way of savings, right? They don't have a savings account, but if they just allow, especially the $20 a month families, they're thinking, let's build it up to $80, $100, $120, and then we can think about some serious kind of expenditure. So we're just starting to sort that through, and I wish I could talk about the results, but they're just not quite finalized yet. It's very complicated to have complete confidence in these results, but we're very excited about it.
Yeah, it's such an exciting opportunity for us to learn more. And obviously the fact that the pandemic hitting we're going to be able to understand how this additional dollars help those families weather that time. And like you said, this additional dollars coming in now, kind of how everyone is using it. And so talk about being the right place at the right time. It's going to be really important for us to learn. There's other countries that have been doing this for quite a while. And I know that on our National Academy Committee, we looked at those other countries. And at the time, Canada was just rolling out their new child allowance. But if ours does anything like theirs, it's going to have a huge impact on families. So we have a lot of questions that are coming in, and some are somewhat specific that my team will try to respond directly to you, and some are kind of bigger in nature. And there is one question that is about the minimum wage. And this was something that was not part of the American Rescue Plan. It was initially discussed increasing to $15 an hour. And I know that in our group, we looked at the minimum wage quite a bit. Our recommendation, or kind of a simulation, took it up to $10.25 an hour. In the state policy roadmap, we recommend having a minimum of $10 an hour kind of now, and could be phased in at higher levels as you go. Can you talk a little bit about the benefits of the minimum wage and whether folks should be worried if there is a minimum wage increase about employment effects? So that there's often concern that a higher wage may reduce jobs. And can you speak just to that for a little bit?
Sure. We were fairly conservative in our committee, as you know. We wanted in these simulations to be able to use research information that was solid enough to be able to cover the kind of scope of the change that we were considering. So $15 an hour, we have some states, some cities have enacted that. The jury is still out about employment effects, especially longer term employment effects. This is a classic case where an economist will say, oh, raise the minimum wage and you'll get more unemployment. But the economic models only predict the direction of effect, not the magnitude of the effect. So that's really the problem, right? If the magnitude of the effect, if there's a little bit more unemployment, and yet at the same time, low wage workers are getting a much higher payment, it's likely to be judged by most people as a net benefit, right? So the jury is still out on that. Our own committee, it's funny, raising a minimum wage, one of the things that we modeled was the cost to the government. And the cost of raising the minimum wage was negative on balance, because if you earn more money, you pay more Social Security taxes, you pay more income taxes, right? So taxes went up in the case of a minimum wage. There were modest work reductions, I think on the order of, it was a fraction of 1% of the workforce. But the other thing to note is it didn't have much of an effect on poverty. And it didn't have much of an effect on poverty because a lot of minimum wage workers are secondary earners in families that are above the poverty line, teenagers, for example. And a lot of the parents who head poor households and are working at wages that are higher than the $10.25 minimum that we simulated. So it's kind of the jury is still out. We'll see what happens. I think the kind of the concern that could be addressed in policy is thinking about differentially setting up that minimum wage depending on the local labor market conditions, right? It makes a lot more sense in a big city than it does in a rural area. So one of our plans was to gear the minimum wage to some fraction of the state median wage, which I think is a good idea. But it clearly didn't make it into the American Rescue Plan. They're trying to come up with a compromise deal that wouldn't take it up all the way to the $15, some fraction, and indexing it to inflation. So we'll see how that plays out.
Yeah. I think that the other thing, which you mentioned already before, is if you're thinking about the minimum wage in context with these other sorts of programs or tax credits or benefits, that you do have to take into consideration the whole picture, those things that are kind of pro-employment and those things that might make it so folks would either be less likely to work or benefit from working. So what I've been telling people is that most of the studies that we did on the minimum wage, when folks kind of demonstrated that there were reductions in employment, were quite a while ago. The ones that we're doing now show a much smaller impact on employment, and that's really because the value of the minimum wage, like you said, has reduced so much, and there's there's room for increases before. But at 15, there hasn't been a lot studied there for sure. There's a question that came in that I wanted to address, that someone was mentioning that it sounds like what the American Rescue Plan is doing and the policies that we've been discussing is putting the onus on the parents to improve the lives of their kids. And I just wanted to, and that they wanted to mention that there are other sorts of things like toxins in the environment. And we could list a lot of things that also harm children. And I think what we're trying to get at is that the research is pretty clear that if parents have the stability and resources, food, housing, healthcare, income, the ability to balance being able to care for their kids and also work, that improves their mental health, that improves their physical health, it improves their relationships with their children. So it's allowing parents to really be the parents that they want to be. But that doesn't mean that we don't need safe environments for our children and a reduction in toxins and so forth. So all of that is also crucially important, as well as creating other institutions that can care for our children, like our child care facilities, our early intervention services, early Head Start, and so forth. So I just wanted to say that this is a both and, it's not an either or of what we're talking about. Some of my favorite questions are, doing the which one is more effective, this policy or that policy. What we tried to do in the National Academy report was to demonstrate the kind of marginal impact of each of the policies, either what it would look like alone or in combination. I think that this one happened to be on early Head Start versus expanding Medicaid, if I'm looking right. And what I would say is that, again, it is a both and, that there are providing broad-based financial supports for families allows them a great opportunity to do the things that they need to do. And then providing those targeted interventions for the kids who can benefit the most is also the strategy that we need. And so identifying who will benefit the most from those things. But Greg, do you have ideas from this plan of things that you're especially excited to see? Are there things that you think states should prioritize their energy on versus others, or do you have any feedback on that?
Well, you're doing the roadmap, right? But it's certainly true that I remember when we were first starting our committee work, we asked for input from a number of people, and one person said, "You're asking the wrong question, right? You're focused on reducing poverty in hopes that reducing poverty is going to improve child well-being. And what you should really do is focus on what improves child well-being. Reducing poverty might be one of the components, but these other kind of programs that you're talking about could be much more important than reducing poverty. It could be less important. So it's best to focus on the child and to think about the environmental conditions, to think about the kind of programs that you're featuring in your policy center, and that perspective, I think, is very important. You can get all tied up with poverty reduction, but you can't miss the point that that's just one component. I think it's a under appreciated component. I think a lot of people are kind of off in the service world where they only think of these programs, right? And they really don't think about the importance of supporting work, of the importance of having some decent level of income as a base, a stable base from which these other things can happen. So again, it's a both and kind of situation, as you say. Poverty reduction is important, but potentially so are a lot of these other things. And this other committee that's just starting up now is going to complete the look. It's going to try to evaluate to what extent programs of various kinds, not only in early childhood, but all the way up through adolescence, promote intergenerational mobility. And the bottom line, I think, for all of us is how do we set up a system that's going to ensure that kids growing up now are going to be healthy and productive adults?
Yeah, right. Helping their parents is one of them. Making sure that we address their needs directly is also important, both individual and environmental. I think that's exactly right. There was a question, a little confusion about why states may not have expanded Medicaid as of yet. And if I had the answer to that, then I might be queen. But it's not necessarily clear as to some of the choices. Probably a lot of it is political. Financially, it's pretty clear that expanding Medicaid can help to reduce state costs for Medicaid. It covers about 90% of those who are currently not covered, who would be covered based on the expansion. And the new incentive payments actually will increase the proportion that the federal government contributes for everyone else by 5 percentage points, in addition to the 6.1 percentage points that occurred about a year ago, just at the beginning of the pandemic. So there's real financial incentive for states to be able to do this. And several states are considering it. Wyoming is considering this. There's not going to be very many holdouts, I think, for much longer. Financially, it makes a lot of sense. The extension of postpartum Medicaid for those non-expansion states is also something that many of them are considering. So it's an expensive way to go because they don't get the 90% of federal coverage by doing that. But they have recognized that that's such a crucial period for maternal and child health that many states are considering that, even if they're not an expansion state. So it is, will remain to be seen if this incentive works in the way that it's meant to. But financially, it is a benefit for states at this point to expand the Medicaid coverage.
So if I may add, Cynthia, it's easy to get into a penny wise and pound foolish kind of situation with this. One of the things that we did in our report was to review the research on safety net programs, right? And to what extent expanding Medicaid in the past actually affected child well-being, child health, and so forth. And there's a lot of evidence that Medicaid coverage, Medicaid expansion, FCHIP expansion, and so forth, produced very tangible improvements in child health. And if you think about the nature of the costs of ill health, right, you could easily end up with a situation where even though there is this modest expense incurred early on, the kind of savings that you get from reduced healthcare expenses in the future is quite large.
Yeah. The roadmap doesn't necessarily look as much as the impacts on kids as it does mostly on moms around the time of the child's birth and or children at their birth. So not the longer term effects on kids' health, but it's substantial at reducing low birth weight babies and preterm babies, which is just an example of what you're saying. Those children are at risk for developmental delays in the future and very expensive in their births. And so this has both short and longer term consequences for the children and families, as well as the state in terms of dollars. So it's an effective policy. There's still some political issues surrounding it, but it's certainly demonstrated based on rigorous evidence that it's an effective policy. So there are several different questions with regard to undocumented workers and undocumented parents and whether they're eligible for the new American Rescue Plan benefits. And I want to be clear about one thing, that we will send out kind of more information to clarify that, because the what I say may not be 100% correct. What is correct is that the benefits are not going to go directly to folks who are undocumented. However, in the past, when you're in households that are called mixed status households, and you have someone who's undocumented and someone who's not documented, that often the benefits would not go to that household as well. So none of these benefits will go to serve folks who are undocumented, but it will get to households of those folks who are citizens living in mixed status households. Greg, you may have greater clarification on some of this than I have, but if not, we can send it out to folks.
Yeah, I never have more clarification than you have.
That's not true. That is not true. You taught me everything I know. All right, well, I'm going to take one more question and then allow Greg for you to have any of the kind of final say in this. And there are folks who are concerned about, there are folks who are concerned about inflation and whether this influx of dollars is going to actually make it more difficult for everyone over the long term. And I'm asking you this because you're an economist, so you can talk about these sorts of things in a way that a lot of us can't. Are you concerned about that? And are we going to, this combined with perhaps the new infrastructure spending and so forth, what would you say to folks who are a little bit worried about that at the state level?
Well, I'm not only an economist, I'm also a very old economist. So I could remember back, in the early 80s when the unemployment or when the inflation rate was 10%, 11%. It was a very turbulent, difficult time. So we don't want to return to that time. The big question, and there's just a lot of disagreement about this, right, is whether the kind of deficit spending that we're engaging in is going to generate inflation. That's the key question. It's certainly the case that that for every 100 times people have feared inflation in the last 20 years, it's never happened, right? Inflation has not been a problem. It's been it's kind of stumped economists who made these predictions that yes, it was going to come back. I think if we're going to get this big growth spurt now, I think once enough people get immunized, and one can tolerate a certain amount of deficit as long as the economy is growing, right? Mm-hmm. I think I've heard that this big infrastructure bill, right, which is going to be at least as big as the American Rescue Plan, that there will be a tax program that will be considered shortly after that, that would be undoing some of the 2017 tax reforms that might bring back the estate tax in a substantial way. I think rethinking the nature of the tax system to pay for some of these kind of expenses is a very prudent thing to do. But whether the American Rescue Plan itself is going to be inflationary, do you believe Larry Summers, or do you believe any number of other economists? And what we thought was true 20 years ago and 10 years ago wasn't true. So it's a bit of a risk. I think that has to be balanced against the kind of benefits from putting this money in the hands of and the other kind of services that you've talked about. And we'll see. I think some people could judge it's a reasonable bet to make. But I think once there is a number of months of worrying kind of inflation indicators, you're likely to see, the Fed start to take action and other kinds of debate over what can be done to make sure that doesn't start into runaway inflation.
Yeah. Well, I appreciate that. I know that may not be central to the idea of creating a Prenatal-to-3 system of care, but I think the more that folks can get a sense of what we know about this investment in our families and children, and what we don't know, I think is really important, that we're going to be learning a lot. I'm just going to close out by thanking you for the time that you've spent today. I know that Denise wishes that she were here and would be able to talk with us more and more about what she's seen that states are doing to try to promote greater equity, because this is an opportunity not to just remain status quo, but to actually create differences that will bring about greater equity and reducing disparities between race, ethnic groups, between socioeconomic statuses, and so forth. And we're going to be tracking that at the Policy Impact Center. I know that others are going to be looking at that we want to learn from you at the state level, what it is that you're doing, what is it that's working, what are you struggling with? And there is no right answer, except that we need to make sure that we shore up families, we shore up those who are providing for our families, to make a sustainable infrastructure so that we can get our families back to work, they can balance care and work, and that our children will thrive. So I'm excited about the opportunity that the American Rescue Plan is providing to us for research, as well as what the program and services will do for families. And look forward to having another conversation about what was the impact of the American Rescue Plan on the Prenatal-to-3 system of care. And Greg, I'll invite you back then. You can tell us whether any of your predictions have come true, as well as more about the baby's first years, because that's going to really help us to learn how this sort of investment in our families can make a huge difference in their children's well-being. So I know that we're going to put up a slide now to remind everyone that we have our launch of our second Prenatal-to-3 State Policy Roadmap coming up in October. It will be an in-person and online virtual event. We'll be able to do both so that we can reach everyone who is interested in learning more. But thank you, Greg, for your time. Thank you to all who have attended today. And I wish that you have a great rest of your day and that everyone stays safe and healthy. So thank you again.